into Kakaki Cancer Awareness. Of course, this is hosted by the founder of Commode Cancer Foundation, Dr. Dennis Ejo, who always does this every fortnight on Kakaki, the African Voice. Of course, she has two guests to analyze some issues with her today. They'll be looking at resilience on the cancer journey, two sides of a coin. And of course, her guests are Dr. Raphael Emeka Ogbolu, who is a consultant psychologist, and also a cancer patient advocate, Gloria Okwu, will join her. Over to you, Dr. Dennis Ejo.
Morning, ladies and gentlemen. How are you?
I'm okay. Good morning. I'm looking good as always.
You also look good. Every time I see you, you're always looking good. Good morning, viewers. Good morning, viewers, and welcome to another edition of Kakaki Cancer Awareness with Dr. Denise Ejo, the CEO of Commode Cancer Foundation. That's my name. Good morning. How are you? I hope everybody's having a good time, and everybody's gone back to school now. Good morning, my guests, Dr. Rav and Gloria. Good morning.
Good morning.
Good morning.
How are you? Okay, so let's go. This morning we're going to be looking at resilience, and what are we talking about? So the resilience on the cancer journey, two sides of the coin. The reason it's called two sides of the coin is we've got the doctor on one side, we've got the patient on one side, you got me in the middle of all of you. So let's look at how it goes. What is it all about? Together we fight, together we win. We're going to make this journey a lot easier the more we continue this. So what is really resilience? Resilience is the process and outcome of successfully adapting to difficult or challenging life experiences, especially through mental, emotional, and behavioral flexibilities and adjustments to external and internal demands. Doc, did I define it correctly?
Yeah, that's quite that's in depth. There are a lot of definitions.
I know there are a lot of that's just the basic.
Yeah. Exactly. Yeah.
Awesome. See, I do my homework very well. So together we fight, together we win. This is Commode Cancer Foundation in partnership with AIT. We really appreciate all the work you do with us. So let's remember to always click on follow Commode Cancer Foundation. And I've got a special guest in the house who will tell us also about some of the work that's going on in the mental health field, because that's what this is all about today. We've got a YouTube channel, LinkedIn, everything. Just go and look for us, Commode Cancer Foundation. So what's it all about? The two sides of the coin. Dr. Ogbolu is a consultant psychiatrist, and Miss Gloria is a cancer patient advocate. So we are actually defined now as living with cancer. That's it, living with cancer, right? Is that what we're called, Gloria?
It depends on who is speaking.
No, we are speaking now. We are speaking. What are we called?
Sometimes, some people
persons living with cancer.
Persons living with cancer, or survivors, or patients.
We got so many names now.
Yeah, so many names. Or even champions. So.
Oh yeah, champions. Oh yes, I like that one. The champions are the ones I like. So awesome. Let's go. Dr. Ogbolu is a consultant psychiatrist. His medical journey started at University of Ilorin. He went into private psychiatry, practiced fully running a private clinic in Lagos, which I actually went to. That's where first time I met him. I went to go look for him. I was looking for help for my people, until he was appointed a consultant at the Lagos University Teaching Hospital, that's LUTH, in 2010. He has published several studies in peer-reviewed journals covering sleep, suicide, and other topics. And Chinyere. So, Doc, good morning.
Morning.
And our guest, Gloria, is a cancer advocate, a lived with cancer advocate. Yeah, is a career program manager, a trained linguist, writer, and a breast cancer survivor. That's what we always call ourselves. She is the program coordinator of Project Pink Blue and a noteworthy patient advocate in Nigeria who has inspired others by publicly sharing her story and fervently advancing the case of effective cancer care. She's also published something that has been approved. So, well done, Gloria. sometimes it's good
Thank
to
you.
recognize the little things that we do and appreciate that we're doing
Yes.
a lot of work in this space. So well done. Thank you very much. Together we fight, together we win this Common Cancer Foundation. Let's start with the nice questions. And we'll start with understanding our topic for today, which is about resilience. So, Doc, you're going to start this off for us because the question is, what is resilience and why is resilience important in cancer care?
Yeah, thank you for having me on the program. Well, resilience, you had defined it. Another, from a more mental health perspective, I will say it's the ability to maintain and regain mental health despite adversity or challenges. And why that's important, the key words here are, regaining mental health or maintaining mental health and then adversity. So let's start with adversity. If people face, life is full of challenges, sometimes things we don't plan for. People who are diagnosed with cancer do not bring it upon themselves. You understand? Nobody goes looking for that diagnosis or condition. So it could present a challenge, and that therefore could be an adversity. Now, how you deal with that adversity and change it into positive adaptation is really important on your journey through in dealing with the condition. And that's why resilience is really important, because without resilience, you won't likely be able to positively adapt to this challenge that has now, faced you. And if you're not able to adapt, then a lot of other things, the cards come crumbling down. Okay, treatment, adherence, even starting from accepting, what you've got and dealing with it. Okay, it becomes a problem. And then adhering to treatment and understanding that life goes on. You still have a life to live. So without that resilience, it becomes a problem. And that's why just like most other conditions, but particularly, in mental health conditions and chronic medical conditions, of which cancer will fall under, resilience is really important. So I'll rest it there for now.
Thank you. I actually like the way you started it, because a lot of people don't understand the challenges of how cancer patients go through this, especially when we have to look at everything else that comes with it, which is what you just talked about. Okay, Gloria, let's go to you now so that we can get this. So briefly share your story, but what are your thoughts? My questions, what are your thoughts on the effects of cancer and our health?
Okay. Our health in general, or you mean mental health?
No, our mental health. No, we're focusing on our mental health. Today is mental health.
Oh, okay. Okay, so thank you very much, Dr. Dennis, for that question. I think the mental impact of cancer diagnosis has never really been looked at well, especially in this part of the world where mental health issues are not really talked about. And then you notice that people want to treat a cancer patient, want to treat the symptoms, but the person's mind has gone haywire. And I saw a study, was it last year, that over 20% of people diagnosed with cancer are living with one mental health challenge or the other. And I even think that is a very modest number from that research, because being diagnosed with cancer, leaves you very vulnerable and exposed to every kind of mental health challenge. Call it depression, panic attacks, anxiety. You're anxious, you're scared of the drugs you're taking, fear, you're panicking, you're worried of side effects, you're worried of a recurrence, you're depressed from the body mutilating surgeries you have to go through. Everything is a problem for a cancer patient. That's the truth. Cancer is the most toxic disease in the world. I don't know if there's another one. Maybe because I've gone through it, I think it's the most toxic disease, talk about a drug that even, talk about a disease that even the drugs can give you anxiety, can make you depressed. So there's a lot going on with the cancer patient, and we should begin to look at, managing the mental health as efficiently as we try to manage the symptoms of the disease. Because if you lose the person mentally, the outcomes will never be positive. So you have to start thinking of how to manage all the problems. It's a whole mirage of problems. It's a whole world of disease on its own. The mental health challenge that comes with the pain of your medications or the pain of the cancer itself. Where are you going to start from? It's just too much. So it's something I'm so passionate about. It's something I've gone through, something I talk to people about, and I think it should become as important as treating other symptoms of cancer. Thank you.
Thank you, champion. Thank you. You said it very well because, Doc, I think you said it very well because sitting on the chair, and one of the things I've actually enjoyed about this program is I allowed vulnerable cancer advocates to say it as it is. Because a lot of the time, you have cancer, we're not asking people to be sorry for them. We're asking people to recognize that it's not just about medicine. Our world, medicine has now become like 30-40% of the whole sickness, right, Victor and Gloria? 30-40%. Our mental health is totally damaged, no matter what anybody thinks, because we go into stigmatization. We go into what people think about us. We go into a lot of financial, emotional, behavioral, like you just said, Doc. That's our life. And no matter what anybody thinks, we are not asking you to give us a pity party. We're asking you to give us the structures and the things that we require to be successful. Okay, so let's go. So I've started this part because the question I want to ask you is about this, and we both live with the disease, meaning that we are in active treatment. That's why I've put it that way. Both of us are in active treatment, and we have been for an excess of 5 years. So that means in medicines, in hospitals, going from one doctor to the other. So that's why you need to help us with this one. What is the role of hope and social life on resilience, especially in Nigeria, where a choice needs to be made between caring for one's family against the fight for the disease?
Yeah, hope is really important. Now, when you talk of resilience, we can break it down into the personal factors, okay, and the biological factors, and then the environmental factors. Now, under the personal factors will come things like one's personality, optimism, and hope. Some people are, by virtue of their personality, more likely to be more optimistic than others. Some have the tendency to see challenges as adversities as challenges. All right, see more from a positive point of view. Okay, but we're all not like that. So if you're someone who has that personality already, your personal factors can equip you to be more resilient. Now, some may have to learn those things, change that mindset. And that's why when you hear the word adversity, okay, and in this case, when replacing that with cancer, what does it mean to you? You out there who don't even have cancer, what does it mean to you? Because you never know tomorrow if you will have it. So it's that what we perceive it to be. If already you hear the word and all you think is gloom and doom and gloom, that already is impacting on how you will adapt, your positive adaptation. So appreciation of what it means, and it doesn't mean doom or gloom. People live with it, just as you guys have done. And it's really important that people understand that, and that's where the hope comes from. And that's the beauty. I like what Gloria said. I mean, and the fact that you put her there to, give her own account, because it's all when people share their experiences that gives other people hope. because a lot of people feel they're alone. It's a closed space because of the stigma, when people get diagnosis, they don't even want to share with family members. For a while, they keep it to themselves. And in doing so, you are limiting the available resources. When people share their experiences, it helps and gives people hope I'm not alone, which is very powerful. And these are things that feed into that hope, which you talked about. Now, the other biological factors, we know that people who, for no fault of theirs, have gone through adverse childhood experiences. It makes them more vulnerable to succumb to future adversities. So if they have a chronic medical condition or they have difficulties later on in life. So resilience actually starts from childhood, how we nurture children, okay, how they develop. That could equip you for future resilience. And then the environmental factors. Okay, what is your social support network? All right, things like that's where spirituality comes into play, your culture and things like that. Our systems, good healthcare systems, even good school systems that help to build resilience from a young age. So all these put together, combined, help to promote resilience. But where do you yourself sit in this? I think the value of, in our society, the value of experts by experience should be championed. And I like that word champion. I think you should stick with that one because it's really important that people champion this. And it's only through that, because I mean, as you've said, and as we captured in the previous session we had, it's beyond the diagnosis. There's a lot tied to it. I recently had to discuss with someone whose partner was the one who was awaiting the outcome of a screening. And the anxiety was more on the partner who wasn't the one, So the impact it has on others, even just that anxiety. Mm-hmm. They don't know what to expect. What does this mean for us if this person does have a diagnosis? How will our lives change? So it goes beyond, the person who themselves is experiencing it, but that person also has to draw on hope and resilience from other people and strength from others.
Thank you, Doc. See, that's why I like to have you here, because you make this thing look nice and easy. Gloria, you explain it so that everybody will get exactly what we're trying to say. Because we need people that can get through to the vulnerable, because no matter how we look at it, we are deemed the vulnerable. But it doesn't mean we're not strong in character or in everything else. The challenges that come with the disease makes us vulnerable. Okay, so I'm going to say, Gloria, just a quick one on this one. From your story, and a lot of people will know your story because we talk about this the same way I talk about it, the same way you talk about it. So, yeah, you have, I would say, our camaraderie living with this disease has opened the doors for us to look at a lot of other things that come up from the disease. Okay, what kind of support? And okay, let me look at it from pain, because pain is to me, I look at it that there's a pretending going on about this pain that goes with cancer, and the point is the pain hits the oblongata, as far as I think, and that immediately throws your mental health to zero. Yeah? Yes. So now the question I have to ask you is, what kind of support can elevate that in your own view? Because it's a challenge that we face. It's not medicine. It's not the drug. It's I don't know what to say. You know what I'm trying to say. Go on.
Yes, I think you asked two questions in one. So I'll start from the pain. Yes, I know the last time we talked about, I told you I had not slept for 5 days because of pain, and I'm only recovering. I'm a bit bigger than this, but I lost so much weight from pain. And yes, pain reduces one's quality of life drastically. So you can be all happy this moment. You can be all happy this minute. The moment that pain starts, the quality of life drops to almost zero, because it's not just headache, the kind of headache pain, or it's the kind of pain that you lose appetite, you don't want to sleep, you just live on the edge, and your regular painkillers might not even work. And then you start struggling to get some of the drugs they prescribe for us for pain here, morphine, which is not easy to come by. In fact, sometimes you might be shocked how patients will tell you how difficult it is for them to get morphine, cancer patients. So I don't know if it's because some of these medical practitioners have not gone through this pain, that they don't understand that morphine should be readily available for cancer patients, like readily available. As long as you are a patient, as long as you can get a prescription from your doctor, you should just walk into your facility and pick up morphine, so that your quality of life, can be enhanced for as long as it can. Pain is not easy. Like I was telling Dr. Dennis, I did not sleep for 5 nights because of pain. My eyes were open and I was literally going crazy. And that is what many patients will tell you they've gone through. Although mine is not really my doctor's problem, I'm scared of starting on morphine, and so I'm looking at other little measures I've developed over the years to keep managing my own until I might be placed on morphine one day by force. So mine is not my doctor's fault, but I know a lot of patients who are not on morphine because they don't have access to morphine, or the access is very limited, or they can't even afford it. So on the other side of managing these mental health issues, what other resources are available? One thing I tell cancer patients is not to lose yourself. Even in the pains, like I was a bit angry with some of my friends who were asking me over the week, are you not coming out to sing? Are you not coming out for karaoke? I was a bit upset with some of them, and I know they noticed, but I don't blame them. It's because they know I'm a very positive person, and I used to hop on one leg to go and sing. So even when I'm telling them I'm in pains, they want me to hop out on one leg again to come and sing. They don't know that this pain is something else. It might be more than what they used to know. So they know that nothing keeps Gloria down. And so they expect that when I tell them, oh, I'm in serious pains, I've not slept, they expect that the next 5 minutes I'm coming out, I'm with the microphone and I'm gyrating. So, yes. So you don't have to lose yourself. I always tell people, that small window of relief, make yourself happy with it. That small window of opportunity, do something nice with it. Still try to do the things you love. Talk to people about how you're feeling, so that they know exactly how to help you. They know where to come in. A friend came to my house, just to come and give me a massage. It's not much. Did it make me sleep? No. But it meant a lot to me. And that is what that person felt they could offer at that point in time. So talk to people, don't hide away from your challenges. Don't deny the fact that you're in pain. At the same time, tell people. The last time we lost somebody, I told people in the ESCO group that my mental health is in rags, that I'm traumatized. I'm tired of hearing somebody died. And I knew I had to take a break. I gave myself a break intentionally. I stopped taking certain calls intentionally. I stopped some counseling sessions intentionally because I was going crazy myself. I felt like holding my head and screaming. And I knew I was not in that position where I'll be counseling somebody. So I said to some of those people I'm counseling, I'm not okay right now. Once I'm okay, I'll talk to you, please. So I took myself off some counseling sessions. I took myself off some burials. I just started taking myself off some activities that were triggering my anxiety and bringing me face to face with this fear that I was trying so hard to manage. I even gave myself a break from the hospital visits. I know that might not sound fine.
We are coming back on that one.
I had to do it. Yes. We are coming back on that one. So you have to check what to do as a person and what you can allow others do for you just to keep yourself going, because you don't want to be a crazy cancer patient. It's too much for one person to deal with. So
thank you, Gloria.
Yes.
Thank you. A quick one now. Doc?
Yeah,
Gloria
I
has
think
hit some very big points for us.
she has.
And as you would appreciate, the reason I had to bring this part in is because it was so funny, but we both shared this, and our mental health has been going crazy because of pain.
Yeah,
I
yeah.
am fortunate to have access to morphine, and
Mm.
even then, the pain is excruciating. And a lot of people don't understand that the effect of pain automatically triggers the mental health to just nosedive, and you can't explain to someone what it's all about. So that's where we are. I'm going to ask you the next question, and the next question is to do with the Mental Health Week and the mental health programs that are coming up, because I think it's important now that people know where to see what's going on around and start seeking to be part of it. The Mental Health Week and the day, Suicide Day, is coming up, and those are trigger days for a lot of people. How or how are patients' challenges being embedded in your program on this? I know there's a program.
Yes.
So please, can you also share details so that we can make sure that this message goes out and people can really engage, because seriously, it's a big thing for us.
Yeah, thank you so much. I mean, and quickly just to mention that when Gloria first said it's the most toxic disease, I started thinking, what does she mean? What does she mean? You know, but when you think of the concept of pain, all right, you can understand part of this toxicity and the impact it has had on sleeplessness. And these are all ingredients that obviously will impact on one's mental health. But I also like the fact that she mentioned, and that's really a very important tip for people, be involved in your own treatment journey. Be involved in decision making. It empowers you, and that itself gives you hope. And just to mention, I think it would be wonderful if Kumod and all other organizations in the cancer space could liaise with the pharmacists, because the problem you talked about morphine. When I was in Luth, before I left Luth, we had a symposium on pain. Is the fear that we have about people becoming who don't need morphine, who will abuse morphine. But if you work with pharmacists, that we can get around that. So that's usually why people maybe push back on prescribing. We know that people who have genuine pain do have it. And when you talked about pain, it's two sides. You have the physical pain and the psychological pain that people go through. So the physical pain can beget the psychological pain. People do not understand the psychological pain. And that's why when you have the physical pain, they expect you to come out and sing karaoke. They don't know it's beyond that, because it also leads to psychological pain. And it's that psychological pain that tends to push people to the point where they're depressed and they may become suicidal. And so that leads us to our event this week on Saturday, the 16th of September. Stopping the Suicide Research and Prevention Initiative will be having its national conference to commemorate the World Suicide Prevention Day, which was actually the 10th of September last Sunday. But the whole of this week is marking that. So, and what we are doing to answer your question is, we are focusing on people sharing their experiences, just like similar to what we've done today, because we have to take it beyond. I mean, it's so easy for we who are the caregivers or the professionals to prescribe for people that what we think you need. No, it's important that we understand what people actually think they need. You know, so paternalistic attitude, we want to begin to shed that, where we think we know what's best for you. We need to hear you tell us what's best for you. So the focus of this conference is actually inviting people. I mean, just as you've experienced the stigma related to cancer, there's also, there's quite a lot of stigma related to mental health. People don't want to come out and say they've got this. But thankfully, this Saturday, we've got people coming to share their experiences and tell us what they've gone through. And we're hoping that through that, it will give a lot of people hope and encourage others to also share their own experiences. So that's what we're doing. Thank you.
Thank you, Doc. Thank you, Gloria. Really, I really like this, because sharing experiences actually, I think, is the main guide to holding someone's hand through a challenge and helping them navigate the best way that works for them. I want to thank both of you for joining us. Together we fight, together we win. It's Commode Cancer Foundation. Thank you. And it's SERPIN. So let me get that. The mental health this time is going to be looking at shared experiences. So anyone in shared experiences, please connect and see how you can be part of it. It's a determinant. Our success stories make a difference in people's life. We want to thank you, viewers, thank you both for joining me today as well. Thank you. I really appreciate it. And thank you, viewers, for being with us. Thank you. 2 weeks' time, we will be looking at something else very interesting. And a lot is going on. Next month is Breast Cancer Month. A lot of things are going on. Let's be able to keep abreast of what's going on and look around.